So I have to say that what really got me interested in doing work around health equity and social justice at that intersection was really informed and inspired by my experiences working, for example, as a case manager with the Department of Family and Children's Services, and also working for the Georgia Department of Public Health in the AIDS Drug Assistance Program. And what I noticed was that there was there were these gaps that existed in people really achieving the height of health and human health and wholeness. And so, as an example, if you're a person who's underinsured or uninsured, then it becomes more difficult to pursue other things in life and other goals that you have if you're worried about where you're going to live or how you're going to eat or how you're going to get the medical care that you need. And I started to see that in a lot of the work experiences that I had. And so in particular, my experiences at the Department of Family and Children's Services, where I served lots of families facing challenging social determinants of health and gaps in many, many areas. While serving as a case manager at DFACS, or Department of Family and Children's Services, I talked to clients every single day. I talked to folks who needed food stamps, who needed temporary assistance for needy families, who needed housing, who needed mental health and emotional wellness services. Talk to them about their lives, and even students that were in school but didn't have enough money to pay for food because they were working to fill the gaps with tuition. But I talked to them about their lives and about sort of what they needed. Folks who needed mental health services, I watched them come in, having breakdowns because they weren't getting the medication that they needed. They weren't getting the medical services that they needed. And so I really understood what the everyday life of these folks looked like, having conversations with them, getting to know their name and their children's names and their family members' names that would come into the office over time. And so I started to put things together that there were people behind a lot of these stereotypes, number one, diagnoses, number two, and also illnesses and challenges that were undiagnosed. But there were people with stories, with lives, with journeys, with needs, personalities, relationships, families, behind these statistics, what is seen as statistics in public health. And so I think, the commonality between all of these folks was that there is, and what I started to realize quickly is that there is a relationship between poverty, between lack, whatever that looks like, people who are underemployed, underinsured, unemployed, uninsured, people who don't have access to education or healthy food or a secure and safe place to live. There is a relationship between those gaps in human need and health equity, right? There is a lack of balance. Right? When you are healthy, it's not just about your body, right? It's about your mind. It's about the way you live and the conditions in which you live in, and that determine whether or not you're able to thrive, how well you're able to thrive, and how well you're able to function in a society like ours in the United States. And so, all of those things are components and aspects of health. We know that as social determinants of health, right? And when there are gaps and when you don't have access to one or more of those things, that creates the inequity. And the inequity is about health, and health is holistic. Health is about our human experience, not just our bodies. And so for me, I think one of the most important aspects of the research that I've done is really first person, talking to people about their lives, because I found that in talking to people about their lives, you will inevitably arrive at whatever the public health issue or concern or condition is. Whatever the inequity is, if you talk to them about where they were born, if you talk to them about their family, if you talk to them about the conditions in which they grew up, if you talk to them about the way that they think about the world, the way that they were taught to understand the world, the things that they learned to fear, the things that they learned to champion, if you get that backdrop of that human experience and that story, that is where you're going to start to uncover, the most telling aspects of what makes the person who they are, and what created the health inequity, or where the social justice disconnect really rests. You will learn all of those things just by allowing people to tell their stories. Now, people are going to want to share lots of things. Some things that will feel irrelevant and some things that will be a little irrelevant. But eventually you will come to the place where all four of those corners meet, and you start to recognize clearly the public health issue, the health inequity, the social justice, the lack of social justice, or the social justice inequity as well. And so I learned to ask these questions about people's lives, and I'm really learning to listen. Research is about listening. Listening and allowing people to share their story, so that you can then point out, what the intersections are and what they look like. But I learned how to listen. I gotta say, that first job in Atlanta, Georgia, as a case manager, for people who needed social services, I learned how to listen to what their needs were, because at that point, my job was to figure out how to guide their applications. What should these people be applying for? What services should they be applying for? And in order to do that, I had to listen to the narratives. And as I allow people to talk to me about their stories and where they were and what was happening in their lives and what the barriers were and what the challenges were, that's when I start to say, this is really interesting, in that there are a lot of alignments in a lot of these stories. People are coping with the lack of, and that sort of causes them to need services. Through my work in HIV, I think that furthered my understanding of how important it is to listen to people, and how important it is to respect people's stories. And the feedback that I've gotten from a lot of patients, and as we're talking about the patient journey, is that doctors will often tell people their stories and will tell people what's best for them without even listening to what their experiences have been. And I think it's common knowledge now among clinicians that you can diagnose a condition. That's easy. That's what clinicians are trained to do. But in order to really treat the patient, you need to be able to understand the patient, understand the whole story. A quick example of that is with adherence, right? With any type of medication adherence, you need to understand what the person's life is like in order to know why, how a medication is best, to set a medication up for success, to work best for that patient. You need to know, what hours they work, what kind of work they do, when are they sleeping, when are they getting up in the morning, do they have any children, is this a parent who is or a caretaker of some kind, who has a tendency not to pay attention to the time of day or the things that need to be done for themselves. All of those factors and more, really go into not just the diagnosis, but how you can fully understand the patient and fully treat the patient. And that is a part of the patient journey as we understand it, right? So it is our duty to, as folks in public health, to do everything we can to fully understand as much as it is possible the patient journey, right? And the patient journey is about the patient's life. What does the patient care about? What does the patient fear, etc. And so that's what I try to do in all of my pieces. And I'll just give you just a quick example or an overview of how I've been able to write narratives based upon the patient journey. It's really just a conversation. It's about sitting down with the person and saying, hey, can you tell me about who you are? Can you tell me about, where you grew up and how you grew up? Can you tell me about your parents? Can you tell me about somebody you trusted when you were young? And then can you tell me about, how you came to understand doctors and medicine, and what was your relationship with the healthcare industry? Was there any fear? Was there any mistrust? And if so, let's try to unpack that. When's the first time you heard something like that, right? Or, who are your friends? How do your friends feel about the healthcare industry? What groups are you connected to in terms of your identity, right? Do you identify as Black, as white, as Asian, particularly in communities of color? Do you identify as, for example, in a lot of the pieces that I've written, do you identify as Black first, or do you identify as LGBT first? Or and all of these things are really important around how people think of themselves first, then how they think of others. It even, do they value their own life? I mean, this is about mental and emotional wellness as well. There are times when, as we know, if people are suffering with depression, maybe underdiagnosed depression, right? Are they likely then to be adherent to treatment? Are they likely then to seek out medical services if they don't even feel good about their life and themselves? So these are all things not to assert, but to keep in mind and to ask. Ask the questions about how people feel, and knowing what to ask really is a very important key part of research, number one, and then also identifying, where the inequities and where the injustice lies.